Hi students, this is Dr. Ways and welcome to your lecture on the arm. When we talk about the arm, we're talking about that region from the shoulder down to the elbow where the cubital fossa is. All right, so we've mentioned a lot of structures that were involved in arm movement, particularly when we talked about the pectoral region as well as the shoulder region and the overview of the upper limb. But now we're specifically going to go into more detail about it. So first we'll talk about the fascia in the compartments. So this cross section down here of the arm, we see that there are, of course, skin, and then we see the superficial fascia, which we've seen with the abdomen and the lower leg, which is that fatty layer that contains areolar tissue as well as adipose tissue. And then we have the deep fascia, which is the blue lines that you see in here. And notice that they invaginate into the muscle compartments themselves to separate them into two separate compartments. The anterior compartment, right here, which is also known as your flexor compartment. So it will take your forearm at the elbow and flex it. And the posterior compartment is the extensor compartment. So it's going to extend your forearm opposite of that flex position. Okay, why I included the muscles of the arm here, but nowhere else in the upper limb, I'm not sure why, because we're going to cover these later on. But within the anterior compartment, you will have your biceps brachii, your coracobrachialis, and your brachialis muscle. And again, all of these are going to be flexors of the arm at the elbow. There is only one muscle in the posterior compartment known as the triceps. So even though it's one, it's got three different components to it. And that's going to be, again, involved in the extension of the arm at the elbow. So again, we're going to cover this when we get over to the muscles of the upper limb. For the arteries of the upper limb, or I'm sorry, for the arteries of the arm, we've already talked about the axillary artery, and then when it gets past the third part, that inferior border of the teres major, then it becomes the brachial artery. All right, and the brachial artery will continue down on the medial side towards the cubital fossa, and it's within that cubital fossa that you'll be able to take the brachial pulse. And we'll talk about that when we get to the cubital fossa. And so that's going to supply muscles of the anterior compartment. But then this profunda brachii artery is going to pass to the posterior compartment of the arm and supply blood to the tricep muscle. So this is a picture of the arteries of the arm with all of the muscles stripped away. And so things to point out here would be the axillary artery then becoming the brachial artery, and here, and then the profunda brachii artery will continue along the backside or the posterior part of the arm and again supply the triceps brachii with blood. Notice that there are other branches, the superior ulnar collateral artery. All right, so notice that is going to be a collateral artery along with the ulnar artery when the brachial artery branches just distal to the cubital fossa into the ulnar and radial arteries. So to that end, you're also going to have the radial collateral artery, the middle collateral artery, and the inferior ulnar collateral artery. And again, notice that these are all going around to this elbow joint, so that's going to be that redundant circulation, those anastomoses, that will supply blood to the distal parts of the arm if any one of the major arteries happen to be compromised, either physiologically, anatomically, or pathologically. Okay, as for the veins of the arm, we generally said that veins will follow the course and the name of the major arteries. Where that is not true is this basilic vein here and the cephalic vein here, basilic being medial, cephalic being lateral. But if you look at the brachial artery, you have that vena comitantes situation where the brachial artery has two brachial veins running on either side of it deep within the muscle. And you see that up here with the profunda artery too, so you're going to have the profunda veins coursing along with it. For the nerves of the arm, they're going to be the same ones that we covered with the brachial plexus, so none of this should be new to you. You have the musculocutaneous nerve, the median nerve. Here's a continuation of the musculocutaneous. The ulnar nerve running on the medial side, and the radial nerve then running on the posterior, then lateral side of the arm, until you get to the elbow joint, and then it's going to strictly run laterally and strictly run medially, and that medial nerve is going to run down the middle. So specifically, even though all these nerves are running through there, it is the musculocutaneous nerve that will, and its branches, that will supply the muscles of the anterior compartment of the arm. And it will be the radial nerve that is sitting behind all of this. Here's the radial, and it's going to course behind. And the radial nerve then is going to supply nerves to all the muscles of the posterior compartment, all right, as well as some muscles of the forearm. But here we're talking about the arms of the posterior compartment. So musculocutaneous, anterior compartment, radial nerve, posterior compartment. So if we want to even go further than that, the musculocutaneous nerve would be the biceps brachii, the brachialis, and the coracobrachialis. Whereas the posterior, the radial nerve in the posterior compartment would be supplying the triceps brachii. All right, so here's another picture showing that radial nerve coming posteriorly. And remember, the radial nerve originates from that posterior cord, so it makes sense that it would run down the posterior side before it runs down the lateral side of the arm. If you extend your arms out in front of you as you're sitting here listening to this and look at your elbow joint and that indentation that's there, what you're going to be looking at is what is called the cubital fossa. All right, fossa means indentation, cubital means the elbow region. All right, so the cubital fossa is this triangular shaped region that spans the distance of the elbow joint and is important because it contains major artery and nerves that you should be familiar with and that are you're able to palpate. All right, so if we look over in this side right here, I've outlined the cubital fossa in red here. It's not a perfect triangle, so there's a little bit of a deviation in the formation of it, and that is due to the way the muscles course. So it's going to be a slightly different from person to person, but generally a triangular shaped region. Its boundaries are a line between the lateral and medial condyles. So if you go into lateral and medial condyles, there's an imaginary line right between it that forms the superior border. The medial border would be the pronator teres. The lateral border would be the brachioradialis right here, and that would round out your triangle. Deep to the cubital fossa, which we consider the floor, would be your supinator muscle as well as your brachialis muscle. And then what you're going to find within the cubital fossa is, of course, the brachial artery, and that's going to be one of the more important ones. So I really want you to notice the brachial artery kind of comes from the medial aspect and continues medially towards the medial side of the arm, going to the middle of the arm, then crossing over to the lateral portion of the arm. But when it's in the cubital fossa, it's going to be oriented more medially on the arm than laterally. And that's important because you want to know where to feel for that brachial artery pulse. And you're going to start feeling more on the medial portion of the arm at the cubital fossa rather than on the lateral portion, because I've seen a lot of people make that mistake. They'll put their fingers over here looking for the pulse when it should be more over here. Okay, toward the medial aspect of the arm, or of the cubital fossa rather. So medial to the brachial artery would be the median nerve. Okay, the ulnar nerve would be already on the medial side, so it's not going to be part of the cubital fossa. And then on the lateral portion of the cubital fossa, you're going to have the radial nerve and some branches that are coming off of it. So in terms of nerve and blood supply, it's going to be from lateral to medial, radial nerve, brachial artery, median nerve, and in between those, you're going to have the tendon of the bicep brachii. All right, so all together, you have the radial nerve, tendon of biceps brachii, brachial artery, and the median nerve. And all these are going to be considered deep structures of the cubital fossa, all right, because on top of that, or superficial to that, you're going to have a layer of fascia, and then on the next slide we'll show you some of the more superficial structures that you'll see running through the cubital fossa. And then one more interesting fact about this region that I told you I'd talk about early on is the fact that the ulnar nerve is running this direction, and it's going to run behind the medial epicondyle. And because it runs back there, and often we hit our elbow on things, our medial side of the elbow, and it hurts really bad, and your arm and hand goes numb for a little bit, we refer to that as the funny bone. But it's not really the bone that's making you feel that way. It's this ulnar nerve that's running around the medial epicondyle that gets hit. And it's not so funny when it gets hit, but since it's part of the humerus, I think that's kind of where it got the name funny bone. And just one thing I noticed that I forgot to mention is up here is a drawing of your cubital fossa, and notice that they're showing your radial nerve over here on the lateral side, tendon of biceps, brachial artery, and then our median nerve right here. So just another picture showing you the order of things within the cubital fossa. So here's that fascia that I told you about that covers up the deeper structures that we talked about within the cubital fossa. And then the veins that are running superficial would be your basilic vein coming here from the medial side, and your cephalic vein coming from the lateral side, and they're going to join with each other at this structure called the median cubital vein. All right, and if you look at your cubital fossa, extend your arms out and look at the veins within the cubital fossa, you'll notice this vein that kind of crosses over from one side to the other. That is the median cubital vein, and that is one of the superficial structures within the cubital fossa. Other structures that you can find there are your medial and lateral cutaneous nerve of the forearm. So that's going to supply the skin of your forearm with a sensory nerve supply. And again, that's going to be running superficial within the cubital fossa. All right, and the last thing we want to talk about are cubital vein variations. So on the left picture here, you see an arm right here, and this is the same thing I told you about in the last slide. If you extend your arm out and look at the veins, there's going to be one that crosses over from one side to the other, and that's going to be your median cubital vein. And so what you see on the picture to the right of that is somebody took blue coloring and artificially colored the surface of the skin digitally. Of course, this is a digital manipulation of the skin, so you could see actually where all the veins are coursing as part of this venous system in the superficial part of the cubital fossa as well as the forearm. Then this picture I like because often when you look at bodybuilders, they have veins bulging out all over everywhere, and there's nothing special about their veins. It's actually that they have very low body fat, and that's why their veins are sticking out. But you know, you can clearly see the median cubital vein right there. I'll erase it so you can appreciate it. Medial cubital vein. But what they've found is that there are many different types, at least up to 7 different types of median cubital vein variations. Okay, so remember laterally you have the cephalic vein and medially you have the brachial vein. But then where they cross over and meet each other varies from person to person. So you see this arrangement right here that they call type 1 or M or Y. You notice the Y right there. Or if you don't want to look at it that way, you can see the M right there. So they named it according to, you know, the letter that it kind of makes. Type 2, N or H. So the H you can see right here. The N would be right here. Type 3 would be the I or the O because there is no median cubital vein actually there. Sometimes the cephalic vein and the brachial vein will just continue on and split after the cubital fossa, never getting a median cubital vein involved. Another variation is that you have the basilic vein, and then it crosses over and continues on as the cephalic vein on the lateral side, and the medial side it will continue on as the basilic vein. So that would be type 4. Type 5 is not on this slide, and I'm not sure why. But type 6, type 7. So I just want you to get an appreciation for that there are many different variations in the median cubital vein. I don't believe that they have any significance in terms of health, but you know, be aware of the variation. So this is just one of the things that you might see, and I recommend looking when you get to the lab at the anatomage table. Look at the 4 different bodies that are in there and at the median cubital vein, and see if you can see any variation yourself in those 4 bodies.